Actually, 4 of us dialed in at 6:30, which is what the meeting invite said.
Oh,
That's so it can start early. All right, Dr. Warner, we're ready to call the meeting to order. We are on live on YouTube video.
Okay, and we've got audio with that?
Correct.
Good. I'm going to call the November 12th, 2020 Board of Health meeting for the Skokie Board of Health to order. And before we proceed, I need to read a statement. I should have this memorized by now, but until further notice, meetings of the Board of Health will be held electronically, with the majority of the members participating via remote access in order to comply with the State of Illinois gubernatorial disaster proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Bruce A. Jones with the Skokie Health Department, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by email to citizencomments@skokie.org, by mail to the Village of Skokie. Attention, Bruce A. Jones, Interim Director of Health, 5127 Oakton Street, Skokie, Illinois, 60077, or via the Village's drop box located by the Village entry to the public entry to Village Hall. And before we get started, Bruce, have there been any comments so far that have been submitted?
Let me double check. I'll give me just one moment.
this is Bruce getting his steps in during the meeting.
Good. He needs to.
Yeah, we don't run around enough during the day.
Right.
There have been no citizen comments submitted as of yet.
Okay. All right, thank you. All right, well, I'd like to welcome everybody to the meeting. And Ashley, is this your first meeting with us?
Yes, for me it's the meeting.
Welcome.
Thank you.
And Sybil, you've been with us before.
Yes, right.
Yeah. Anyone else that is new to the meeting tonight? Otherwise, welcome to everybody. Thank you for taking the time tonight. I know you're all very busy traveling around the United States.
House.
The first order of business is the approval of the minutes and the agenda, and what we've been using is a consent agenda. You should have received the agenda and the minutes, and unless there are some items that you wish to extract, and I should say, Bruce and I worked on some minor editorial issues, such as punctuation and capitalization, and those have been taken care of, but they don't affect the content. So unless somebody wants to discuss punctuation mark, I will accept the minutes and the agenda as approved by consent. Seeing no objection or extraction.
No.
Yes? Someone have a comment? No. All right, well, I think we really need to concentrate on the issue at hand, which is the COVID-19 pandemic and the impact that it's having in the village and in particular on our health department. And so I'd like to spend most, if not all the meeting, talking about that. There's a few other items we can address, but I also want to point out that the health department is really busy just addressing the COVID crisis. And we do important work, but I think we really need to concentrate on the matter at hand and either defer other issues, not that they're not important, but to allow especially the staff to concentrate on this critical item. So with that, I'd like to get an update on the COVID and the flu update. Sue, you're going to cover that tonight?
Yes. So I'll start with flu, because that's a little easier, I think, right, Mike? We've had 2 flu clinics. As you know, we had one September 30th, where we saw 844 residents, and October 6th, where we saw about 744 residents. The clinics went extremely well. We did social distancing. The clinics were 9 hours instead of 4 to allow for social distancing. We did adults only. We chose to do that since it's an indoor setting, and I can't vouch that all children do well during a flu clinic, and that I wouldn't be able to, that I would be exposing the staff and myself to 15 minutes of prolonged screaming and other things in that community setting. So anyway, we decided to do adults only. It went extremely well. The comments were very positive. What can I say? It went really well. We were very pleased. We also have done employee flu clinics for all segments of the village, for Village Hall, for Public Works, for police and fire, and actually police and fire immunized their own staff and police because they did get the approval from IDPH that the paramedics could do immunizations because normally they can't do preventive types of procedures. And so they did do that, and this was to get them ready and prepared to assist us for when the COVID vaccine comes out. So that went really well, and so they were, so that since all of them were on 3 shifts, they were able to do that, and that also assisted us in taking the burden away from the health department nurses. And so that went extremely well. On to COVID. We are extremely busy. Skokie is no different than the rest of the state. The cases have increased. And so we are busy daily doing contact tracing. In fact, we are doing, Mike, to let you know, for the Salesforce portion, we are contacting the cases. We are educating the cases and giving education about isolation and quarantine. With the volume of cases we have and the number of tracers we have currently, we're not able to enter all contacts in and put everyone into monitoring, and everyone understands that, because we wouldn't get through probably 75% of the cases a day, and we want to reach them at least 90% within 24 hours of receiving their test result. So that's how we're handling the contact tracing. We are seeing increases, and Mike, you can chime in at any time. We know the hospitalization rates are going up. Glenbrook Hospital now has reverted again to all COVID. They had reverted from that when cases went down, but they are back to all COVID, no other procedures. Elective procedures will be done. And our long-term care facilities, as you know, cases are rising, and they're rising in large part because it's being brought in by asymptomatic employees. Starting immediately, employees have been tested. I didn't let them go to twice a month when things calm down. I continued weekly testing all throughout the summer and the fall. And now long-term care facilities are testing their employees twice a week. This begins immediately. One of our facilities had already started doing that. And I know before the meeting, Dr. Warner was talking with us about the issue of staffing, both for hospitals and for long-term care facilities. And it is an issue because there are a number of asymptomatic employees who then have to quarantine, and they are down staff. So it is an issue. We're also trying to stem the tide of the employees bringing COVID into the facility, and I had a discussion with Dave Rahia this week from the president of North Shore Hospital, Skokie Hospital, and we discussed the N95s and are they being fit tested. And so I'm in talks with all of our facilities. Most of them do have fit tested N95s if they're the molded ones. Obviously for the duckbill ones, those cannot be fit tested, and some of them are using that. We also sent out emails advising them to make sure that they are in contact with their suppliers about PPE, because we know that there's going to be an issue with PPE, and the health department is unable to supply long-term care facilities with all the PPE that they need because we don't have those types of supplies. We've been supplying some of the home care agencies, some of the developmentally disabled day programs with PPE, because they've been having a hard time getting that. We have been in constant contact with all the schools that are open, and not all of the schools are open. And those public schools that are, for the most part, it's the public schools, they are talking about going back to remote. I know District 69 did. The high schools are going to have a, Mike Charlie is really, our new director, is going to be coming in on a great time, but he knows this. We have a meeting scheduled next week with Niles Township District 219 about their plans. And our guidance right now is if you're not open at the present time, please don't open. This is not a great time. We are, as I say, we're hearing from those schools that are open. We've had to close classrooms in a number of schools. And what, you know, as I say, it's from all aspects of the community. We're just seeing an increase, and we're trying to stem the tide.
Sue, there's been controversy over especially high school sports. Are any of the teams competing now or planning to?
The teams are not competing. We had heard, you know, summer and into the fall, there were track meets where there was COVID, and we had to deal with that. We've even had orchestra. They would meet outside, socially distanced. There are even bags that you can get for various instruments, especially the wind instruments to blow into. We haven't had anything from the musical departments. We did have some issues with some of the teams practicing, but they're not competing to my knowledge, because we would have gotten those phone calls.
And no pressure from parents to start competition. I know that's been an issue in other districts.
No pressure from parents. Actually, the pushback, interestingly enough, that we have had are from some of the daycares. And it's not the daycare directors, it's the daycare parents. You know, when you have a positive kid, and you have to close a classroom, and you've got to isolate and quarantine, that's 14 days. And obviously they're in daycare because they want to be working, correct? So, and it has not been the issue from the daycare directors. They have been really on board with us. It's the parents who are giving a lot of pushback. The schools, not so much. And when I've spoken to, actually the principals and the superintendents, are really, really in alignment with the health department recommendations. And they are speaking about closing, but of course they have to get permission from their boards of education. They're talking with them. And most of them are on board, I believe so. You know, I know that, Mike, you gotta hear this. Everybody that calls from schools wants us, the health department, to give them metrics for schools. I don't have those metrics, right? We're not getting metrics from the state, and I have to explain that. And all I can do is talk to them about what they're seeing in their own schools, what we are seeing in the community, and as I say, make recommendations. If you are not open, now is not the time to open. Thanksgiving is upon us. We know that given all the recommendations and advice that we're getting from the state about not holding gatherings, we know that it's going to happen. We know that we are seeing increased cases from family gatherings, from people going out, from young people still seeing friends because they still don't think this is real. It's real. There have been some banquets that have occurred that Skokie residents have attended. Sizable banquets where we've seen spread. So we expect post-Thanksgiving, this is not going to let up. And we understand that it's, all of us here, I don't have to preach to the choir, right? We all understand that this is difficult, but that's the only way to stem this virus, is to limit social gatherings. And the community is on board with us, for the most part.
Well, I saw yesterday in the e-version of Skokie News, there was a very excellent piece about how to have a safe Thanksgiving and several different tips. And so I think the village is reaching out. Hopefully people are receiving that and paying attention to it.
Right, the quarantine approach, trying to get people to quarantine 14 days before the actual event.
Right.
Right.
Yeah, we started that here at home, that we're quarantined. Yeah.
So, Dr. Werner, you wanted me to share our screen real quick on our...
Yeah, if you would. I hope you're all accessing the daily reports that come out Monday through Friday that show what's going on in the village. Now, it is somewhat behind. It's dependent on, as I understand it, IDPH reporting the numbers.
Yes.
And there's some variation, but there's definitely been a spike in the last, 2 weeks or so?
Yes. You know, we're mirroring the state.
Yeah.
And again, so when the schools are asking, should we reopen? Because we had been lower. We're not, as I say, we're mirroring the state. I have to talk to people about Skokie, and the people that you employ are not in a bubble. Skokie is not a bubble. People are from all over. They're from different parts of the state. So you have to consider that.
So hopefully, I'm sharing my screen now. Hopefully you can all see this. Are you seeing the screen?
Yes.
So this is the COVID-19 page. If you just Google Skokie COVID-19 page, this should be the first hit. And it gives, as you can see, a multitude of resource links here, from the businesses to testing sites, mental health, how to be a good neighbor, how to protect yourself and others. And obviously the one that everybody's, we're trying to direct as many people as possible to this location, because it helps get people the answers directly. Not that we're here to answer the calls, obviously, and all the staff are answering whatever comes in, but this is a really good resource. You can see it was last updated yesterday, which is about the best data we can get. Sometimes it's 2 days behind. It just depends on what comes in. We want to make sure that it's accurate, and that's what I try to tell people. There's no point in us putting out data that is incorrect, and then we have to go back and retract it. And so we have a disclaimer, obviously, at the top that it's based on the data we receive, but it really shows you, what we're seeing here in Skokie, the total number of cases, recovering, ill, deceased. The nice thing about it on some of these, you have the ability, and I apologize, hopefully you can see this as I move this around, you can actually change it. So this is all the cases by the various age ranges, and obviously you can see it's pretty well distributed. The 20-somethings are leading the way, but you can actually go and just literally do it by month, and you can see how things change. This was, is that August? My eyes are getting old.
August.
Yes.
And then you go to September, look how the numbers have now gone up to, are not quite as bad, but then you get to, is that September?
I can't see it, it's behind our faces.
Oh, I apologize. September, October, and you can see now the cases are up to 90 in those age ranges. And then as you go in the next month, same thing, well up to 80s and 90s, and those are a breakdown, and those people are still ill in those categories. So that's what we're seeing, that's what's coming in right now. So this is really, good data that we're trying to get out there. Hospitalization or age ranges, broken down by hospitalized, discharged, and deceased. And then by week admissions, so you can see that's correlated with our spike in the cases also, male to female. And then our confirms, and again, here you can select, you can click off and just go, and it'll show me October and November. And you can see, and this is where our rolling averages are just, going, you go back to here at the beginning of October, look at that, our rolling moving average was 5 cases a day. And then as we've gone up to here, we're at 43, I think, rolling cases a day, 20, if not more. So,
And
Just-
I
just-
think there's one on the screen that shows positivity.
Yes, and so the last one is our positivity rate. And right now, it says 10/25, but that's the week between 10/25 and 10/31. So we started this nomenclature, we probably would have been, in retrospect, probably better off putting the end date so people would know that, but that's why we put that up there. So, and again, we try to get this data as quickly as possible through the state's website. There's just so much data coming in from the labs and testing. So as soon as it becomes available and we feel that we've got the accurate data, then we post it out here. And you can
Now
see our
that-
numbers are lower. Right now, Cook County's metrics, when I looked this morning, or I should say Region 10, which is Cook County, and those graphs on the state's website are, the most recent data is from the 9th, and we're at over 13% in Region 10.
Region 10. And Mike, the number that that we're paying attention to is it 8% positivity? Above that, things are getting out of control? Is that
Correct.
their statement?
That is correct. That is the measure, the resurgence metrics that are posted on the state's website. They list a number of metrics that you could look at to see whether or not that region has exceeded the thresholds that are set. So it's 8% positivity rate in 3 days or more. Oh, there we go.
Yeah, I thought I'd bring this up, Mike, so you have it right here. So this is Region 10. See if I can move this out of the way a little bit over here. So you can see
This is
Region,
something that I would urge everyone to look at daily, just to see these alarming trends, which are very, very worrisome. In full disclosure, I must say that I am not in the country currently. I'm calling in from Belize. So I'm sitting in my kitchen with my patio behind me. So I decided to call in because I've been here for 3 weeks now, but I still maintain my role with the state health department in providing guidance to schools. And I do that throughout the entire state. And then my focus, of course, as Sue knows, is Cook County, which does include Skokie. So I'm still very much in touch and trying to do what I can.
That's
But
good to know, Mike. Thank you.
Yeah, thank you. You're very much appreciated.
I think these trends are I was struck by the data that Bruce just shared. If you look at the age ranges of the new cases, you can see that dramatic shift whereby back in March, this was being driven primarily by the elderly and folks in nursing homes. And now we're seeing all of these new cases that are driving this pandemic in the younger age groups. 20s, 20 through 40. And I think that speaks to the fact of personal behavior,
Yeah.
in terms of people not following the guidance. And I think they do it either out of defiance or out of denial.
Yeah.
I was pleased this week that the CDC made the statement regarding masks, saying that masks not only protect those around you, but they also protect the wearer, which is something I've felt for a long time, and I'm very pleased that they've come out with the statement, which speaks to the importance of wearing a mask. Every day, if we do this, we can drive these infection rates down until we get the vaccine. But it's getting people to comply with these basic measures. Wearing a mask, social distancing, avoiding crowds, cleaning your hands. If we do those 4 things, we can make a difference.
Yeah, and I'm apprehensive with the Thanksgiving holiday coming up. Many of the colleges and universities are ending their semester, and so these young people are going to be coming back, and they're going to want to see their friends. They want to get together, and I'm really concerned that we're going to see more young people getting infected and spreading the disease.
We're also concerned about young people coming back from school and bringing COVID back to their families.
May I just make one point? I was listening to Sue's report, and she said that the schools are asking for metrics that they can use
Yes,
to make decisions. There is such guidance, Sue, and I can send it to you right after this meeting. It's called adaptive pause,
yes,
which clearly lays out some measures that schools can use to help them with that decision making, and you can guide them along. You can't compel them to close, Sue, as we know. That's a decision for the school board, but we can certainly give them reasoned guidance based on science as
Okay.
to what the right thing should be.
All
But
right.
again,
Any-
this is a great site. Again, you can just simply Google IDPH county metrics, and this will be probably the first hit. And so we're in Region 10, as you can see, I keep saying unfortunately, I'm always using that word lately, but now as of November 9th, we're at 13.7, and that's not trending in the right direction. And then our hospital admissions, 10 days of increase, we're above that metrics. And then here's the rolling average for bed surge. So 20% is what the target or threshold, and you can see we're now below that. So, yeah, we try to get the word out.
Ed, you've got a comment? Your hand's up?
I have a few questions. It's based mainly out of ignorance. I have a hard time identifying Region 10 on that map. So what is the distances that involve the whole region? What communities are we talking about?
So the Region 10 is, basically in this case, Region 10 is just all of Cook County. Those regions, Sue, I believe, are based on our MABUS regions, I believe. Is that correct? The hospital regions? Dr.
Yes.
Vernon, maybe you can also,
There's 11 of them altogether.
Right. So-
Initially, the state used to produce these metrics by county, and then they decided to switch to regions, and they've broken the state out into 11, as Bruce says, the MABUS regions.
so 11 is Chicago proper, 10 is Cook County proper, but some of the other regions, Region 8, I believe Region 8 is DuPage and Kane, and some of the other regions, like Region 1 is about 5 or 6 counties up in that east portion of Illinois.
So thank you, because Cook County is the second largest county in the United States. It's
Yes,
over 700 square miles, and so it's an enormous piece of real estate. And many of the other regions are a little more defined. It's easier to understand. So here's my other question. I'm not trying to throw fuel on the fire, but what has impressed me is the lack of compliance, even in Skokie. And I know that it was last week when there was an event associated with the farmers market, some Halloween type activity, or 2 weeks ago, and we were walking down Lincoln towards Oakton, and there was a hair salon that was open on a Sunday, and neither the hairdresser or the client were wearing masks, and they're 6 inches apart. And I don't know if they're living in the same bubble or if I said in place. I walk into restaurants often because I'm carrying out. I have not and do not intend to dine inside a restaurant right now. It's so inconsistent. I see people, behind the counter. Often it's, in the carry-out establishment. When I ask them to put the mask up, and they put it up because it's around their chin. And it's even worse in Evanston, where they have bar areas in the restaurant where people are sitting 6 inches apart, talking probably for about an hour or longer. And clearly this is an absurdity. And I don't know if there's any attempt, or if there should be encouragement, like a hotline that encourage people to call in if you see violations, from businesses. And I'm not trying to pick on businesses, and I feel terrible for them. But if they're a health hazard, it concerns me.
well, I can say they're to call the health department, and I can tell you that we've responded to thousands of complaints, just exactly of what you told us. So if it gets called into us, we respond. So
And the general public knows to do so.
I can say pretty much our citizens know how to call us and get
They
hold of
sure
us.
do.
Every day I come in, there's voicemails on our system and voicemails in my mailbox. My number is out there as the direct line for most of these people. We've done e-news blasts to all of our businesses throughout towns, not just restaurants, but all the businesses, to let them know that they need to report positive cases to us and also to report any type of violations. We get calls from hair salons reporting hair salons. We get, you name it, we've seen it.
So the other thing is some establishments now are putting out tents, but they're closing the tents up. And granted, the tents aren't necessarily, hermetically sealed, but to me, why is that any better than being inside the restaurant? It looks like there isn't adequate ventilation. And granted, they're trying to make a living. If they have the space, they're moving outside. But they're not following the recommendations of having two sides open.
This is Larry. Can you answer a question for me also? Can you hear me?
Yes,
Yeah,
Yes,
we can hear you.
Yeah. I travel up to, now we've got a lake house up in Antioch, and I'm traveling up there in Lake County quite often. And I have come across entire neighborhood parties of firefighters having parties outside in the yard, no mask on, less than 6 inches apart, and they're all just right there having a big time, drinking beer and having a good time outdoors, of course. But still, can you put on the website or give us some phone numbers to call in other counties that we could call if we want to report a problem and an issue? I know, Lake County Health Department, Kate, different, because we all I travel. I do travel to other locations. So would you be able to do that, or do I need to look it up online?
I'll see if we can get a sort of a compiled list of the main ones throughout our region. The
Thanks, Bruce.
NIFIC region that we have is the eight largest counties up here, so those are probably ones that you would be talking about. And yeah, I see the same thing out where I live. I was out yesterday in DuPage County and driving along, and just there's places that are blatantly just signs outside, indoor dining available, come on in. So that's what we're battling. Not just Skokie, but everyone.
I have noticed that several establishments in Skokie have signs on their door. You cannot enter without having a mask on. Is there any kind of standardized campaign to get businesses to put those kinds of signs up in their doors, in their windows?
So
Many of the businesses
we
that
created a sign that was distributed to every restaurant in town. It was, we've got both 8.5 by 11, and I believe it's 11 by 17. So, that was an expense, and we try to give those out to places that we encounter on any type of complaints if they're having issues. So they can also go to, the local print shops. Several local print shops here have printed those up, and it's a pretty standard format with the Skokie logo on there.
Again, I'm very sympathetic to the restaurateurs, and I realize that they're struggling for survival. But, and also very understanding, the fact is that in one particular place, young men, we're talking a group of them, and we're talking about, these look like tradesmen. They weren't students necessarily. They were coming in large numbers around lunchtime, and none of them had masks on, even though the thing is on the door. And I mentioned it to the proprietor, and he said, "What can I do?" And, I think everyone's very frightened and reluctant to engage, a group of people, and, I just feel very powerless in the whole thing, in terms of, what to do. But I realize this behavior is what's driving, this escalation.
Yeah, and you're seeing it throughout the state that people are I won't say they're being defiant, but they just are not complying. And how do you enforce that without becoming the police?
Well, I hear the dialogue, especially coming out of DuPage and Will County, that they don't believe the state's data. And they say, show us the data, and they're gonna defy the governor's recommendation. And a recent study was just done, and I saw it released to the AMA. It was a collaborative study between Stanford University and Northwestern, where they cleverly were tracking cases based on cell phone data. And clearly, the number one place to acquire an infection, according to their conclusion, in terms of risk, was a restaurant.
Yes.
And I think if we're going to allow them to be open, then there needs to be some kind of enforcement mechanism. And granted, I understand who's going to do it. Everyone's very busy doing other things, and I just toss that out there because I'm pleased that Skokie, considering what's going on, is a relatively lower positivity rate than some other nearby communities. But there's no fences or walls,
Right.
And people are moving back and forth. And I just think that we're faced with a very difficult situation, and I don't know what one could do to intellectually engage it. Clearly, and I'm going to put a heap of blame on our federal leadership or lack thereof. And we don't have to belabor that point. But I think if there was a constant message coming, from, and I'm talking about elected officials and appointed officials and not the scientists who are being muffled. And I think we're just faced with this. It's hard enough you're trying to do it on a local level, but people are in front of their TVs all the time.
Yeah. Ashley, you had your hand up. Yeah. I think you're muted, Ashley. We're still not hearing you. No.
Did she activate her mic when she logged
Yeah,
in?
it doesn't, it's not showing her as muted, so I don't know if she didn't activate her microphone.
Let's give her maybe a moment to call in by phone. And thank you, Dr. Warner, for noticing that she had her hand up.
Ed, this idea about the tents outside, our climate may actually be limiting that now. Do you want to sit out in the tent when it's 15 degrees above zero with a 30-mile-an-hour wind? Probably not. I'm not making excuses, but it may be self-limiting as we get into the winter. Risha, you have your hand up.
Yeah, as you know, I echo the sentiments of what we may do as a citizen of this country, but the thing is, we see in and out every day when I go to work, it's not that the temperature is going to limit them outdoor activities, but they're still having indoor activities.
Yeah.
Families getting together, the birthdays and all of this, funerals, like all of this. So we are helpless. Even in the clinics, patients do not want to wear the mask. And if they say, they're getting very angry, and we are kind of scared. How far can you go with this one? We're seeing such an increased amount of COVID here. I'm glad, Skokie, we all say that the mask has to be mandated. But the thing is, I go to Jewel, the time they have the mask is below their nose. I wonder, I was in Mariano, this woman wouldn't want to wear a mask. What can you do?
You're not supposed to do confrontation.
You cannot, because we are scared.
It's dangerous.
Dangerous, because we just had near our clinic, 2 doors from our clinic, they had a thing that only we can protect ourselves by wearing double masks if you are going outside, people who want to wear it, so double masking and limit the amount of timings that we go outside.
Ashley, are you on the phone now?
Yes, I am.
Oh, okay, we can hear you.
Echo?
You're good.
Okay.
Right.
Sorry about that. Well, I wondered if there's a way in which we can take action as a board, no matter how small it might be, through maybe public education, through social media, at least I find that people can really lead in important ways by just continuing to beat the gong, bang the gong, and just continue to carry the messaging, because without that, people just, I think, are desperate. I mean, as a parent with 2 little kids at home, and I know there are others in that same situation, I think folks are falling into desperation. But, we're all connected to different communities, and we're, different communities here in Skokie, lots of neighbors, so I'd want to encourage us to find one simple way in which we can take an action together to try to spread the word and do a little public education.
I think that's a good idea, and if any of you are, next door is a platform, lots of people see that. If any of you are on that.
Now there's a feedback, yeah.
Yes. And other platforms, yes, that you may be on to spread the word.
Nikki?
Can't shut down every store, every bar, but if you were to pick out 1 or 2 and advertise it, maybe somebody would get the message. You can't do it everywhere, but if you closed, let's say you closed Jewel, you think that people might get the message? We close restaurants after inspections when they're not up to the inspection, having been on inspections. If you make an example of one person for even a day or 2 days, if the message got out there that you need to wear a mask indoor in a store, might be draconian, but maybe people would then get the message.
I'm going to ask, by what authority could we do that?
By what authority do you close a restaurant who doesn't meet health standard? If I went on to restaurants to see if they were meeting the standards, whether or not the refrigerators were up to par, how they were cleaning. What standard did you have to close a restaurant because they weren't being up to the code for the restaurant? I don't know. I'm asking how is that different if a refrigerator is not up to par, that you have to close them until they fix the problem? What's the difference between that and wearing a mask if there's an edict to wear a mask? I'm just asking.
Yeah, I don't have an answer to that.
How about asking Bruce?
The difficult part about that, the closing of restaurants based on some of the things you mentioned earlier, obviously, we do that, albeit rarely, where we consider it an imminent health hazard. There's been pushback, obviously, from a lot of businesses and everyone, even with the governor's gubernatorial decree and mandates, that we have the ability to close somebody based on that. And being that, not that everyone is always in compliance, obviously I will not make that claim, because obviously we do go out and get calls, but many times we are out there, the day after the event, or, I'm just being honest, we're not like the police. We're not running out there and responding in 2 minutes to the call. So when we go out there, even if we were to witness somebody not wearing their mask properly, we're going to tell them to do it. We document it, they comply, and we're not closing a business down right at that time for that reason.
But Bruce, if I might just say, we have the authority as public health to shut these establishments down if we deem that they are putting the public at risk. And I've done it many, many times, and I've had mayors call me, really mad and upset. But once they know that this is state law and the state will back you up, You know, you do have the authority to do certain things. And I think there was a recent change in the rules as well in Springfield to include wearing masks. I'll have to try to find it if I can and send it to you, but, you know, I believe that there is some mention of this.
No, there is. It would just have to be obviously from the top down that if we were gonna be closing a place down because one person wasn't wearing a mask.
Correct. Well, the police will come out, you know, and they will issue a citation. And I think there are like 2 or 3 steps, or they will actually close an establishment down.
You know, we're talking about sticks, can we look at carrots too? If we have an establishment that is rigorous in terms of enforcing mask compliance, I know there's a local barbershop beauty salon, you don't get into the door unless you've got a mask on and you keep it on the whole time. Could we make them exemplary citizens in this whole thing and by that encourage people to use the business because they are compliant? Ed has his hand up again now.
Great minds think alike, Bill. So I have the same idea, the carrot versus the stick. Maybe we should set up an award system, publicize it to the public that if you come into a place and you see them in compliance, you feel comfortable and everyone's wearing masks and there's proper social distancing, that they could send in the name, and if they accumulate a few of these, there could be maybe a citation that they can display that they've been awarded, you know, a COVID safety citation or something like that. And try to put the pressure on the non-compliers who don't have the, you know, aren't getting these recognition.
We could call them maybe COVID busters, just like Ghostbusters, and have some kind of catchy theme so that people would buy into it. I mean, it's just an idea, but, you know, and we have a new director coming on board on Monday. Is that when Mike Charlie starts? He may have some ideas as well. He's coming from Oak Park. I'm not sure how their compliance is there, but these are all great ideas. Heidi?
I would agree that we're more likely to push people with the empathetic approach. We can be punitive, and we should be when we need to. But we've got this wonderful phrase, we're all in this together. There's something to be said for how do we propagate that and have that open heart that says, look, these are my parents and your parents, and, you know, that love is so great that somehow we can do this. And it seems that some sort of community public health communication campaign could happen, and it could be fairly viral, and maybe we need that tagline or catchphrase or something. But I do feel like we're all in this together, and being punitive works to some degree. But right now, people are so willing to get angry. They're just on that cusp of just being furious at the smallest thing. And I would love to figure out a way for us to like turn that tide in a way that speaks to people's hearts, because that's what ultimately moves people. Thank you.
Ed?
I'm going to borrow the hackneyed phrase from my youth that may work on the younger demographic that appears to be quite active in acquiring this infection. It's that, you know, their freedom ends where my nose or my nasal pharynx begins. And to try to emphasize the importance of the fact that, yes, people want to be free and do what they want to do, but there's consequences when they get too close or are not covering during this particular pandemic.
You know, I agree, Ed. You know, a gazillion years ago in English, we would say you want to make old bones. right? You want to live long. Like, I would love this demographic that we're talking about to want to make old bones, right? To live that long, and the people around them to make old bones. And I don't know in like 2020 what that's called, like how you get that heartstring going.
We want to die young, but very late in life.
That's nice, right? So, I think there's got to be something. There's always that punitive option, but it angers and it doesn't compel.
Well, these are all great ideas in terms of putting together some sort of PR campaign to give a positive and also explore what we have in terms of being able to, let's say, a chronic offender, or there's a place that has a notoriety for, what Larry was talking about, large gatherings of people with no social distancing, no mask wearing. Bruce, you and I can maybe talk about this in the next couple of days and see what ideas we have and where we can go with this. Larry?
Yeah, I just wanted to pass something along. And I see this every day at Midwestern where I work. Our president of Midwestern, and we're both here and in Arizona, she is sending out a message on a weekly basis, basically reminding students, our young 20s, students, to be responsible and understand that they're threatening the faculty, they're threatening their families by not complying with COVID restrictions. And that is being done by, quote, the employer and by the person that runs that organization. If these people are coming in mass to a restaurant, they're coming from an employer or they're coming from a school. Do we know, or can we do a survey of employers in the Skokie area? How many of them enforce mask rules in their location and enforce the mask rules for make sure that their employees know that they have to wear the mask until they are home, inside their home. If they go to places, they're to wear the mask if they want to keep their job or if they want to avoid any problems at work. Because, if they have to get quarantined for 10, 14 days, they're going to lose pay. They're going to have a problem with that. I think that's a place to start, is to find out how many people are willing to enforce their own rules in their location where they work or the schools where they go at Oakton or wherever here in Skokie, and then find out if the employees or the students are going to follow that. We have a small problem at our school because students are getting together in groups, getting sick, and missing school. And then they have to make everything up, and they're falling behind, and it's costing them money to have to fall behind because they're going to have to go to school longer. So there's some issues that we could work with to get them to look at that. And the other part of it is, and I'm sorry to say this, but there is a large group of people out there that only care about themselves. They don't care about their older relatives. They just look at what their next fun thing is going to be. We have to be able to break that. And the way to do it is by hurting their wallets. We've got to hurt their wallets. And you hurt that through the employer, you hurt that through the school, and you find out what the families are wanting to do and how they're protecting their older relatives. So to me, I think we need to find out what our employers in the Skokie area are doing to control their employees. Not the police, not the health department, because the employers have to know what they're supposed to do. Is anybody doing that? Bruce, can you answer that?
Well, I can say that, we've dealt with quite a few of our businesses in town, small and large, since the onset. at the very beginning, obviously, there was probably a little bit of pushback and sometimes maybe, I don't want to say ignorance, but since then, the majority of our larger places, and Sue can attest to this, even when we do get cases, they have to provide us a lot of details that we have to enter into the state system, and they're giving us very detailed information on what they're requiring. Some have automatic temperature control devices when employees come in, taking temperatures, making sure they're masked, doing screening, running the gamut from having, hand sanitizers in place, disinfecting between shifts. So we are seeing it. Is that done in every small little business? I can't say that. Some are, as several have said here, some are doing an outstanding job. Others probably not as good. So, but, we might have, don't quote me on the number. I mean, we could have 6,000 businesses in Skokie. And that's just a number that I don't know that we could capture.
Bruce, do we know where the Chamber of Commerce is on this?
Oh, the chamber is behind us. They support us. Howard Meyer sits on the Economic Task Force Committee, which also meets on this topic. So yes, they are behind it 100%. But I think they're, not every business is a member of the chamber. So I think they also have the same difficulties trying to reach everybody. I don't want to speak for the chamber, but sorry.
I would like to add that many businesses contact us. They have been well educated. They contact us to tell us about employees who are ill. They send us the information. They send us their protocols. We're talking from large businesses, smaller businesses, department stores. They give us information about what they are doing. They're doing contact tracing themselves. So there are quite a few businesses that are in contact with the health department, and they know that they need to report their positive employees. At first it was 2 employees was an outbreak, right, Mike? But now it's 5 in a non-medical setting, and they know this. So I have to say a number of the businesses are complying, and as Bruce said, we have so many. It's hard for us to keep up, but I would say that I can say personally that I've heard from larger and smaller employers, and they're doing their best. And they call us also then they seek education and guidance from us. So I've been pleased with the response once they've been educated, because early on they said, we can't give you that information. Oh yes, you can, the public health, right, Mike? And you have to give us this. We've had to talk to corporate from some of our bigger businesses here and say, come on, guys. And they have complied. They've all complied.
Sue, what you're describing, when I would work with clinical staff, that's called best practice.
Yes.
Could we get best practice out into the businesses? This is what a good citizen in Skokie does in terms of best practice.
Well, this is what the employer does to assist.
That's what I mean, as a good citizen.
And that's what I've been getting. In fact, they send it to me. This is what we're doing, and they are best practices.
But could we get that throughout the village? I'm wondering, would it be worthwhile for me to have a conversation with the Economic Council head and the Chamber of Commerce and just say, these are some ideas. The Board of Health is very concerned. We just see this escalating unless we get a handle on it. And it can't be good for their business if everything gets shut down. They've got to look at it in terms of the longer view as well.
Right.
So I can tell you that also on that task force is Matt Brandmeier, who's the head of economic development or community development, and Len Becker, who's one of our lead people up in economic development. They do send out e-blasts to all the businesses that we have contacts with and emails with on a regular basis from the onset when we were back in phase 3, when we went to restore phase 4, when we went into mitigation. They've all been sent those links from the DCEO site They've all been sent those toolkits, which give them details on what they should do, the best practices, the screenings, it's just whether they've taken that and implemented is the question. A lot have, as Sue and I have seen, but there has been no not trying to communicate on our part from economic
Okay.
development. So I can assure you that. It's just whether the message has been received and implemented. That's
Yeah. Okay, and maybe getting to Larry's point, there needs to be a follow-up, just to say, are you complying with this? And I'm not looking for more work for you folks, I'm just trying.
Please don't.
Well, I think we've really discussed this at length and come up with some ideas. As I said, I wanted to keep the focus on this meeting around the COVID crisis. There's one other thing, Sue, that I know we don't have the answers for right now. And Mike, you're probably part of this discussion as well. But there's promise now that there's going to be a vaccine that will be rolling out. We don't know what the time frame is, but there are some plans. I won't say plans. There are some ideas that are out there and some dimensions that have to be addressed in terms of just the cold chain that we've talked about at previous meetings, just the bookkeeping, because people are going to require at least the two promising vaccines right now. They're going to need 2 injections. How do we make sure people come back? So any insider update on those items yet?
Mike, I'm deferring to you. There are plans, but
Yes, there are. And, there's been some very promising signs in terms of vaccine development and vaccine availability. However, until such time that it is available for broad administration to the public, we don't feel that will be until the summer of next year. However, the things that are concerning right now is, as you say, Dr. Werner, the vaccine, the Pfizer vaccine that is leading the way right now in terms of their disclosure that they have 90% efficacy, which is very high. That requires cold chain storage. It also requires 2 shots, 3 weeks spaced 3 weeks apart. And by the time the vaccines reach the market and we start administering them to the public, there will be, I suspect, a variety of different vaccines. However, if you get your first shot from vaccine A, you also have to get that second shot from that very same vaccine. So there's going to be a lot of coordination. But there is a committee working statewide to put plans in place for addressing all of these concerns regarding vaccines, so that once the availability is here, they are set with the distribution. And it's going to be a tiered approach as well.
Yeah.
Those who need it first will get it, and then it will filter down to the general public.
Right. And we had talked about.
Sorry, go on.
No, we had talked about that tiered approach last time as well, that CDC, FDA are working on, that hierarchy of who would get priority right now. Yeah. So it's not a free-for-all. Anything else about COVID or flu? We probably could talk about this for hours more, but we want to keep this to a reasonable time. In terms
I
of.
suspect that with flu, because of all of the measures that we've put in place for COVID prevention, like wearing masks, washing your hands, keeping your distance, will help us with flu. I don't know for sure. I don't know what the data shows so far in terms of flu activity, whether it's simmering on the surface. But
it's low right now, very low.
And we're hoping, Sue, that it will remain that way because of all of the protocols that have been put in place for COVID prevention.
And I think in the Southern Hemisphere, especially in Australia, they had a very mild flu season, just coming off of that right now.
And it could be that correlation as well.
Yeah.
The other thing, though, I do want to mention from the Southern Hemisphere was they were in lockdown as well.
Oh, true.
And so we are not in lockdown, so I don't know that we will do as well as they did. But again, to Mike's point about the 4 things that we need to do, if we can do that, we will have a mild season. Mask, social distance, wash your hands, don't go out to places that you don't need to be. We will, but this remains to be seen. But that was a good point, that they were in lockdown during flu season. We are not.
And hopefully if we have a mild flu season, that's not going to have the impact on hospitals that some flu seasons have. Just to follow up on a couple things from our last meeting, Dr. Williams composed a very comprehensive letter, but concise, on the issue of flavor vaping instruments, and that's been put together and has been sent to the mayor. I haven't heard anything back, but that was taken care of. I think Dr. Lynn has left, but we put together a PSA on bicycle safety. Probably best to roll that out in the spring in connection with Bike Safety Month. And with that, any old business? Any new business? Bruce, any citizen comments?
Let me double check.
Okay. While he's doing that, I just want to wish everybody a happy and a safe Thanksgiving. I know it's going to be different this year. And I think we have to keep our eyes on the prize that maybe a year from now, we will go back to the way things used to be. No guarantee, but it's going to be a challenge with the holidays coming up.
It'll be different for sure. We're doing a virtual Thanksgiving in my family.
Hi, Dr. Werner, though there are no citizens' comments.
All right. Well, with that, is there a motion to adjourn?
A motion.
Okay, second. All right. No objections, we're adjourned. Thank you very much, and we'll see you next month.
Thanks,
Thank you. Stay
everyone.
healthy, everyone, please.
We start at 7 o'clock. All right.
Stay safe.
Thanks. Bye-bye.